Good afternoon, everyone. I hope everyone's having a good day. We're going to go ahead and get started on the webinar. I will turn it over to Holly Carter for the webinar to talk about the NC Lock Your Meds. And please make sure please make sure to make sure your phones are muted so that we don't have any background noise. Thanks so much.
Okay, thank you, Terry. I definitely could not have made it this far without Terry and her assistance. So just want to say thank you to her. Welcome, everybody, and congratulations, all of you recipients. Anna and Aaron and myself are super excited to get the ball rolling on this campaign, and we want to thank you all in advance for your participation, or at least your willingness to participate at this point. So I am Holly Carter. I am the Outreach and Training Specialist for this campaign, and as you probably are well aware, Ms. Erin Day and Anna Godwin are our co-directors. So we want to welcome you guys to the Lock Your Meds media campaign. So just a quick rundown on what Lock Your Meds is. It's a national multimedia campaign designed to reduce prescription drug abuse by making adults aware that they are unwitting suppliers of prescription medications being used in unintended ways, especially by young folks. So this is a program provided by NFP. Our state, North Carolina. Let's see, my slide for some reason is not showing everything it was supposed to. But here is a rundown of how our state is targeting this grant. So this is a grant that our state received the 1st of May. We received, as you can see in the points here, all the big dollars that we got to address the opioid crisis through the 21st Century Cures Act. So that's where this money is coming from. So North Carolina's response to that is listed there on that slide. So 80% of these funds must support outreach, engagement, treatment, and recovery services. So this is a fairly comprehensive grant targeting the opioid crisis going on in our state. It's looking to serve approximately 1,500 individuals in the first year, which I think through prevention we will, that exposure will go a little bit greater. So I want to do just a quick, brief overview on prevention. I know most of the folks on this call are working in prevention, and you guys have a plethora of knowledge in prevention, but there are some folks and organizations that have not traditionally worked in prevention, so just want to give a quick overview and provide a slide for that. So prevention is a comprehensive approach to behavioral health. Also means seeing prevention as part of an overall continuum of care. So it is along with the part of treatment that some folks are a little more familiar with, the treatment side. So it is a small part of, an important part of a big picture. So prevention is delivered prior to the onset of a disorder. These interventions are intended to prevent or reduce the risk of developing a behavioral health problem such as underage drinking or prescription drug misuse, which obviously is what our current campaign is intended for. So in prevention, there are two approaches in preventing substance use disorder. There are prevention efforts at an individual level and at an environmental level. So an individual level, while very, very important, our campaign is falling more under an environmental strategy, an environmental approach. So this is, environmental approaches definitely need to be involved in an individual approach. Both are very important and can support each other. So if you think about working on prevention with an individual, environmental prevention strategies will help support what that person is learning as an individual. So environmental strategies kind of take a broader approach, kind of think of it as the area around that individual. So environmental strategies are used to change the conditions in a community. Those conditions including physical conditions, social conditions, cultural factors that all can lead to substance use. And they are most effective, like I mentioned earlier, when they are implemented as part of that whole comprehensive picture. So included in environmental strategy is communication, and that's what this campaign is, a communication campaign, and education, which seek to influence community norms by raising awareness and creating support around that community. So what is a media campaign? Communication campaign, media campaign, and all the same thing. So we're going to look at exactly what that is and what this can mean for your community and how this can help your organization or your coalition to build capacity that most of you already have in Momentum. So a media campaign certainly can aid in the prevention of non-medical use of prescription drugs. We're hoping to increase awareness of risks. We're hoping to change some attitudes and beliefs. We're hoping to increase positive social norms. We are hoping to change structural factors and also increase the accessibility of health services. So media campaigns are important when you're looking for a wide outreach, so wide exposure, a wide reach, and they are great for getting the message out quickly and reinforcing education, so that education that folks have learned on an individual level, we're hoping to reinforce that and just bring awareness. So how can that help in your community? Environmental strategies can create lasting change in a community normal or in a community system. So, and have the potential for widespread behavior change and hopefully a reduction in access and availability of a drug. So, of course, with this campaign, we're looking specifically at prescription drugs. So, hoping that this campaign can reduce the access of drugs in your community, those prescription drugs. So we do, whoops, the slide was not supposed to be in that spot. That's my apology. So this campaign in our state is kind of set up in two parts. There is going to be a state release. So the state has put in place the media specialist who will be implementing this campaign statewide. So you will see different pieces of media statewide on our television, possibly billboards, different various pieces of media that the state has done. And then you as recipients are going to be doing basically that same thing, but more at a community level. So even though your community may be seeing some of these commercials or ads, the work that you are doing is going to further support. Oh dear, I'm so sorry. Of course, someone rings the doorbell right in the middle of maybe a campaign. I think that's UPS delivering to me. I apologize. So the work that you do will just, again, like I said, support the work that the state is doing. And many of you are already aware that some folks, some organizations are already using the Lock Your Meds campaign. Some of the PFS sites, some of the coalitions or organizations have already started using this campaign. And this grant that the state is providing is just going to further widespread this campaign. So obviously, the more this message can get out, the better success that we should have. So just in review of that, the state is doing their own thing, you at a community level doing your own thing. Existing organizations have been using this, and these all will work together for the success of this campaign. So your expectations and timelines for this campaign. Your first date to have in mind is September 4th. At that point, you will be submitting a tentative media plan, and in that will be included, will be your intended partners and your plan for sustaining the efforts beyond this year, where and how those materials will be used, and ideas for your media purchases and in-kind donations, et cetera. And no need for you to panic, because Anna will be creating a template for you to send this report in, this first report. So those items, I want to go into those in a little better detail. Whoops, not look at your quarterly report yet. So, and I apologize, I didn't exactly get the slides I had intended here. We had a little bit of trouble logging into the WebEx, so I had to use an older copy of my slides. But I did have this broken down a little bit for you. As far as submitting this tentative plan for your community partners, we do want you to go ahead and start thinking about those. And as far as partners, you guys, many of you, especially coalitions, probably have a lot of partners already in place, and absolutely want to encourage you to use those, utilize those partners. And hopefully this will kind of open a door and be an opportunity for you all to add in new partners, and maybe some of those partners that you've been wanting to bring in and just haven't really had that right pull for them. We're hoping this campaign can provide that. So you want to look for partners, obviously, who support this same initiative, and those that are going to have access to our target audience. And our target audience is going to be adults. If you haven't had the chance to read up on the Lock Your Meds campaign, it is intended for adults, you know, in particularly parents, grandparents. So I know most of us who have been working in prevention are used to working with youth, and that's where our mind, of course, first goes, but we are targeting adults in order to protect these youth. So we want to have partners that have access to adults. So we're going to kind of have to be changing gears just a little bit. Most of us are used to our target audience being those who work with youth, and then obviously those that will be included as well. So we want partners that are going to be able to promote and distribute this message. We want to look for partners that have credibility in our community, those who are trusted, and those who are going to have resources available to help us distribute this campaign. And most importantly, and we all hear the sustainability plenty, but we definitely hope that you all are able to secure partners and relationships that are going to be sustainable, and those folks who are going to be there to hopefully continue on this message within this campaign long after this grant is finished. So hopefully this will be a chance for you to build new partners and reinforce the relationships that you already have with some of your partners. So after this initial report, sorry, let me go back to that. We are going to also want, you know, just kind of what your plan is in sustaining this effort, partners included in that, and things that you in your organization will hope to carry on beyond the point of this grant, and hoping to kind of have an idea on how and where your materials will be used. You know, are you planning on radio? Are you planning on your local TV station, your local newspaper, upcoming events that you plan on going to that you will promote this campaign at, and ideas for your media purchases. Hopefully that can be some in-kind donations from your media resources if you've got, you know, public service announcements that your local news or newspaper or whatever publications can provide for you. Your second quarterly report, so back on our timeline, the second quarterly report is going to be for October 23rd, and again, Anna is going to send you a template for that. So don't panic. We're not going to ask you guys to invent any wheels here or reinvent any wheels. She's gonna lay all that out nicely for you. So we hope that by that first quarter, October 23rd, that you can have at least 2 pieces of earned media. So that could be a letter that you sent to the editor, which, by the way, you're going to get a template for that also. I'm working on that. And also you're going to get a template for a press release. So that in itself can be a piece of earned media. And then maybe if you are promoting this campaign at an event, you know, at a school, and that gets covered in your local paper, then that would be also a piece of earned media. So, and I certainly will be happy to spend some time with you later and help you come up with some ideas of that if you don't have things in mind right off the top of your head. We also would like in that first quarter report some pictures of how you have used some of the materials, and we are getting to a materials list. That's probably a question that's popping up to most of you already. We're coming to that in a few slides. And we would love, love, love to have a success story or more, and a description of how you have used the materials and how they've been distributed. You know, maybe you've hung up a poster at the local roller rink, or you have been able to put some rack cards at a nursing home, so things like that. And then at that time, we also want a list of your community partners who have assisted in your campaign, and one completed call with myself for some technical assistance. I will be reaching out to you all, each of you that are recipients. Between now and then, I'll be reaching out to you, but certainly if I have not reached out to you before you have any questions or need any support, please feel free to call me, and I have included my contact information. And I will be, the slides that I will be sending to you all are going to be a little better updated than the ones that I'm currently showing you here on the webinar. And also there will be dates and details of additional reports coming to you. We'll, of course, let you know the dates of each quarterly report and send you those templates. Okay, so here we'll get into materials, on what materials you all will be receiving, which I'm sure you're anxious to hear about. You all are going to be receiving the same number of materials. I know originally, initially, when you were signing up to be a recipient, we asked kind of ask you all for an idea of how many and what materials you have wanted. And due to the overwhelming response, we have decided, just to make it a little easier on everybody, to just streamline a materials package. So each organization is going to get basically the same package. Everybody is going to start with 50 lock boxes. And even though you all are on mute, I can hear you cheering. I can speak from personal experience that that's a great gift to get. So anyway, everybody's going to start with 50, and you certainly will be, we will be open to sending you more. We do have more than that, and you can request those, and that I guess will be up to the discretion of our directors. And then also everyone will receive magnets, rack cards, and posters. And those, like the rack cards and posters, you can personalize those for your organization with like a mailing label. Probably not the magnets. Those I don't believe have room for any personalization, but the posters and rack cards do have a little space where you can put a sticker with your organization on there. But the trademark for Lock Your Meds does ask that you do not cover any existing logos or graphics. So as far as license, we will be able to provide you all, or are providing you all, with a digital license. So that is going to be for print. I'm sorry, that is going to be for online use or phone, if you think like your social media. And then also a broadcast license. So that is for the commercials on TV and radio. And I have here in this slide in parentheses that you may request a print license, but good news, that has changed. We went ahead and purchased the print license, and you will be receiving that as well. So you're going to be receiving 3 licenses: digital, broadcast, and print. Media space and time, that the funding for that will not be provided by us through this grant. So any space and time that has to be paid for will be up to your organization. We certainly want to assist you all in trying to get donations or in-kind time and space so that that doesn't have to come out of your budget. But certainly if you are fortunate enough and have that in your budget, then obviously that's awesome, and that would be on your own. In the fact that we are streamlining the package, if you want to opt out of that, if you do not want that full package, you may let us know by August 30th. So if we don't hear from you by August 30th, you will get the streamlined package of materials. Oops. Terry, are you still on the call?
Yeah.
Okay.
Just following my own rules. Go ahead.
What, Terry? I'm sorry.
Well, I was going to ask. Go ahead.
Okay. The presentation that pulled up was not my current slide presentation, so I'm missing just a few. Is there?
Holly, do you see the one I have up, the other one that's beside yours?
Should I just hit stop sharing, or no, I don't see anything?
Yeah, if you'll hit stop sharing your screen.
Okay. Just to make sure we haven't missed anything. I think these are going to be a little more clear for you all to read. And I think we have gone through most of this. Okay, now here's the part that we had not reached. So I just wanted briefly to go through campaign phases, and I'm certainly not going to spend a lot of time on this because a lot of you already know this information, but just for some of those who don't, I just wanted those folks to kind of have an overview of how you do a campaign, and certainly any detail that anyone needs in any one of these phases, I am here to help and support you. So there are 4 phases in a campaign. The first is planning, second is development, third is implementation, fourth is evaluation. And in planning, luckily for us with this campaign, majority of this work has been done. So I don't want anybody to panic. Our target audience has been defined. Really about the only things that you all have to do is to develop your team. So that's your community partners that we mentioned. So just for you building on those existing relationships that you have, and kudos if you're able to create some new ones. So that we really want to encourage you all to focus on that and use this as an opportunity to build on those relationships and secure those new ones. And then you all are just going to need to assess your resources and the capacity that you have with this campaign. So in developing, most of this, again, has been done for us. Yay. You want to identify your channels. You know, you're going to decide where to use this media. So just figuring out where your adult audiences in your community get the majority of their information. You know, is it the local TV channel? Is it the print media? Is it social media? Then in our messages, hey, this whole message is already written out for us. It's all here. You're going to get it all. You're going to have all the message. So we just got to be clear, you know, on our message and be clear on that intention. And then a distribution schedule. You're just going to have to decide on your, you know, who, when, and where, basically, is all the developing you guys are going to have to do. So then you'll get to the implementation, and then the launching. So in that pre-launch, that's hopefully, you know, that's what we're starting now. Hopefully you guys are going to develop questions and keep those coming to us. And once you develop your team, I want to encourage everybody to have some sort of communication, however your team, your coalition, your organization communicates, to have a page there or a platform where you all can continually ask each other questions and provide that support. But in the pre-launch, you also want to start engaging your partners, you know, start letting those community folks know, or members of your coalition, hey, this is, you know, we got this coming, and kind of start getting an idea on what channels of media that you want to use. And then you'll be launching, which hopefully will be pretty soon. And, you know, you'll be starting that launch with hopefully a press release, possibly a letter to the editor, some kickoff activities. If you've got some activities already planned or coming up, tag this in with it. If not, this is a great excuse to create an activity to kick this campaign off. And then obviously start distributing your different types of media. And then the last phase of a campaign is evaluation. And again, here, you guys don't have to create anything. Anna's going to be providing that template with all the information that we need. And of course, as we all know, evaluation is important. It's important to kind of evaluate what you're doing continually. But those will be included in your quarterly reports, those evaluations. So materials, again, here's a little updated slide, basically the same thing that I showed you before, but including the fact that you'll get that print. license. So, and here was just some highlights on we already covered all this, on your expectations. So here are some resources coming your way. You all will be receiving your materials.
I will be mentioning this, yeah, but that's not the topic.
And the license, if you all are anxious to get started, then yay, we can send you those license anytime. Yes?
Sorry to interrupt you, but if everyone will please mute your phones because we're getting some background noise from individuals. So if we'll mute their phones, that'd be great.
So if you are anxious to get started before you receive your actual physical materials, you may go ahead and start with the license now. So if you'll just request that from us. You guys are also getting a toolkit. I can't believe I haven't mentioned this yet. We have a great toolkit coming your way that is going to take you through every step in detail of an entire campaign phase. And again, a lot of it you're not even going to have to do. You're going to, you know, as far as creating the message and all that. But we are sending you a toolkit that is going to have all the info that you need. We're also going to send you this PowerPoint, the slides from this, and the templates that I mentioned. I'll be sending you a letter to the editor template, a press release template. Anna will be sending the campaign plan and report templates. I will also be sending you a few different web resources on media campaigns and about securing community partners and how you can leverage those partners. You'll also be receiving, like I said, a call from me. And again, want to reiterate, if you need me prior to me reaching out to you, feel free to call or email me. I have included my email and my cell phone number. And also Anna and Aaron, you can reach them at that Lock Your Meds email. And in case you didn't see Anna's last email regarding that email correction, I think when she initially sent you your welcome and congratulations letter, that email said .org, but it's actually .com. So this is the correct one here. So Anna, is there anything else? Anna is here on the call with us. Anna, is there anything that you would like to add in addition to what I've covered?
Hey everybody, this is Anna. I just wanted to touch base on a couple of things, and then we're going to open it up to questions because I imagine you may have some questions. Wanted to clarify on the package that you're going to be receiving, and Holly talked about your opportunities to kind of opt out of that traditional package if you want. Like she said, we need to know that by August 30th, and with that, we're going to kind of need your justification as to why you want to opt out of that streamlined package, because we want to make sure that this is a comprehensive communications campaign, and so that's why everybody's getting the same thing. But if you get your materials and like, hey, we could really use more rack cards, please let us know that we can work with you to get those things. But we want to make sure that all aspects of the campaign are being utilized in each organization. So I just wanted to clarify that you can say, hey, can we kind of change our package a little bit, but we just want to know, we want to have a discussion around why and to make sure that it's a good fit for the campaign. And the other thing I wanted to just let you know before we go to questions is that your materials, we will be getting those to you hopefully by mid-September. There's going to be a lot of work that goes in on our end of getting those mailed out to you. And so that's just a little bit of a process, and that's why it's going to take a little bit longer to get those to you. But you can, and you should go ahead and start working on your media plan, so when you get those materials in your hands, you can hit the ground running. And so that's why we want your tentative timeline and plan prior to you getting those materials. So I just did want to clarify on that and reiterate that Holly's available and Aaron and I are available to help you guys through this however we can. So please do not hesitate to reach out to Holly or Aaron or myself, and we're happy to help you through this process. So I think at this time we can open it up to questions if you want to type your questions in the chat box, and Holly or I will do our best to provide answers for you.
So I see Lindsay has asked about the recording being shared. And she's probably already off the phone because she wanted to know if it was going to be shared because she had to leave, get off a little bit early. So Terry could probably answer that for us. Actually, I think we did agree to record it, but they would be sent separately, the recording and the slides.
Holly, we did record it, and I can send you the recording to send out with the slides. If you'll just give me about, I think, a day to make sure that the recording processes it through, and then I can send it to you.
Okay, thank you. Are there any other questions? Is there anyone that would like to ask a question? Welcome to unmute your phone at this time. And
Holly, I'll give you a couple of questions that were asked in the chat box.
Okay.
One of which is, if we receive the license right away, can we begin purchasing our media?
Anna, is that a yes?
Say that again, Terry. I'm sorry. What was the?
If they receive the license right away, can they begin purchasing media?
Sure. I think we would want to see your express plans, but I don't see any reason why you wouldn't be able to go ahead and start working on that. And we do realize that that media purchase piece is a huge piece for everybody, and unfortunately we don't have the funds for that, but definitely if you have access to resources, whether it's in-kind or your community partners or you have a line item, we definitely encourage you to do that, and we support that.
Or radio or wherever.
So the other question would be, when can we expect to receive the template for the media plan?
You will get all your templates. Next week you will get all the items that were highlighted on that like last slide about your forthcoming things. So you'll get that by next week, your templates, your press release template and all those things.
And there's one more thing while we still have everyone on the phone. Here on this very last slide, Anna just got this email today from CAPT, which is the Application of Prevention Technologies. They are holding, they've got an upcoming event, Engaging Stakeholders in Preventing Opioid Overdose. That's on August the, this is a webinar, correct, Anna?
I think it's technically a call, and it's on August the 31st.
A call, okay, so just like a conference call. It's August the 31st from 1:30 until 3. So if you guys want to go ahead and save that date, I think this would be a great conversation or call for you all to be on. It's a peer sharing call from the Southeast Resource Team. So Anna is going to be sending everyone the link to register for that, but if you want to go ahead and save that date and time, again, it's August 31st, 1:30 to 3, and it's on engaging stakeholders in preventing opioid overdoses. So I think this would be a good opportunity for you to learn of some ideas for engaging your community partners. Any other questions? And I'm happy to stay on the call if there's anyone who is not working in prevention that maybe would like a little bit more detail on what environmental prevention is and how this campaign kind of fits into that strategy. If you want a little more info on that, I'm happy to stay on the call. Just unmute and let me know that you're going to be there. So otherwise, I think we can wrap it up. Anna, is there anything else you or Terry need to add?
I am so sorry. I did not think about it until just now that we should have included in the webinar what the PSA actually looks like, the commercial that will be airing. I did not think to include that. So we will work to get you guys some way that you can see that and see what you're going to be working with, and access to what the radio, what do you call it, radio ad sounds like, or radio PSA sounds like as well. And I apologize, I didn't think with that.
Okay, and I did include I guess what we would consider the digital and print. There's just 4 photos, is that correct, Anna?
There's 4
different
images, and they have
images.
different kind of storylines there about where they get their medication from, those kind of things. But there's 4 that are basically the same as these 2 that Holly has on the webinar.
Yeah, I included those 4 different.
Yeah, throughout. That's right. And I will say, when you get your RAC cards, what we call RAC cards, which are basically the materials like you would see in a doctor's office or something like that, there are RAC cards that are good for the general population, and then there are some that are geared specifically to parents. Because what happens is these cards look like this on the front, what Holly has up on the screen now, and then on the back is some additional information. And so some of those cards are specifically for parents, and some are for your general population.
Wonderful.
And when you get your, go ahead.
How many are we allowed to have of those?
Of the cards?
Yes.
We do not have the exact number right now. I will tell you, we have plenty to share. I don't think anybody will be without. And again, if we send you materials and you say, wait, we could really use more of a certain thing, please let us know and we will get that to you. But we have plenty to share. And what it is right now, we have kind of a stock supply already on hand that we're going to be getting out to you immediately. That'll be what you get in September. And then we will be making an additional purchase from National Family Partnership for additional materials. So at that point, we'll know what we need more of if materials are really using one item over the other.
Right.
So,
okay.
Ladies, there was a question that was posed on the deadline for September 4th. September 4th is actually Labor Day, and most people are off. So do they need to plan to submit their forms by Friday, September 1st? And they're concerned about the time frame if they don't receive the template until next week.
I think September 5th is fine. I don't have a problem with folks turning it in the day after. The template, I'm hoping you will have it by Monday. So, and again, if you have some issues and there's just a reason you can't get it to us by September 5th, talk with Holly and see if there's something first that she can help you through. And then if you legitimately cannot get that timeline to us by then, let us know. And also know that that is a tentative timeline. We're not going to hold you line by line to what you put on there. We really just want to make sure that you understand what this process looks like and make sure that you're going ahead and start working on those communications and what it's going to look like.
Okay, any other questions?
Is there a form